It's a drug that has changed lives, given those who've struggled with their weight a lifeline. And now another one has been approved in Australia. Touted as the new Ozempic, it's Mounjaro. And while the benefits are often spruiked, there's a warning that we still don't know the long-term effects of these drugs. Dr. Nick Coatsworth joins me now. Nick, what do you think of these drugs? Are you a fan?
Well, Ali, it's not so much about being a fan or not. It's more about exploring the potential of these quite revolutionary drugs. We know they work incredibly well for diabetics. We now know that they are very powerful weight loss drugs, but the potential is into addiction medicine, really changing how the pleasure centres in our brain work. And that means that we can talk about alcoholism, we can talk about a whole range of conditions. People are looking at polycystic ovarian syndrome, Alzheimer's disease. There's going to be a lot of exploration about what these drugs, GLP-1 agonists like Mounjaro, are going to be used for in the next 5 years.
OK, right, so they're not just limited to weight loss, which I think is how most of them view them, or in treating diabetics.
Well, that's exactly right. There's a lot about where these drugs actually work in the brain that seems to control how we respond to a whole host of pleasurable stimuli, including eating food. And I had a patient who told me very clearly that being on Mounjaro completely changed the way he viewed greasy food, to the point that he wasn't eating it anymore and he'd go have a fruit salad instead. I mean, these are powerful drugs, but with any powerful drug, we've got to be extremely cautious about any potential side effects that they might have. OK,
so with this decision around Mounjaro, does that mean it's now available to anyone who wants to lose weight?
So this drug has been prescribed to people who were wanting to lose weight, but it was done so in an off-label fashion. So the Therapeutic Goods Administration kind of turned a blind eye but let people do it. Now they're recognising the potential of the drugs and allowing it to be prescribed by doctors to people for weight loss as well as diabetes.
OK, so doctors have basically been doing this for a while now, but now everyone says it's fine. A big drama with these weight loss drugs, lack of supply, and you've got diabetics struggling to access them. Does this solve that or make it harder?
Well, I think what it does is it stops the tension and the competition between two equally needy patient groups. I mean, type 2 diabetics need this drug. People who are suffering from extreme obesity and overweight need these drugs. So we need to look back at the pharmaceutical companies and say, well, let's get the supply. I mean, you guys are the ones that have the patents. You're making the profits out of it. Let's get the supply into the country so Australians who need Mounjaro and other drugs like it can actually get them.
Because, I mean, we've seen the results, right? People who for years have tried to get the weight off, they haven't been able to. These drugs can change their lives. So we can't underestimate, can we, what that does to not just someone's physical health, but also their mental health.
Look, living with extra weight on is not an easy thing to do. And most people try to lose weight. And when you've got a drug that can kickstart that, that's going to change the way people view going to the gym. It's exercising, going down to the beach, all sorts of things. But we've got to remember that unless people want these to be forever drugs, like they take for blood pressure or cholesterol, they're actually going to have to change their lifestyle as well. So it's no good just to take these drugs and don't change anything about how you eat or how much you exercise or how stressed you are. I would always recommend you attend to your lifestyle at the same time if you're going to go on these medications.
Because I think a lot of people do worry, is that a risk here then, that people rely on a drug rather than maintain a healthy lifestyle? That idea that, you know, an injection or a pill is easier than exercise and eating well?
Well, I think there is that risk of reliance on the drug, and I wanted to let viewers know that there's potential effects of that. I mean, we worry that Mounjaro and its sister drugs cause you not just to lose weight in terms of fat, but also your muscle mass as well. So if you've got someone in their 40s or 50s, male or female, who goes on Mounjaro and doesn't exercise, they're going to lose weight and they're going to lose muscle. And if you lose muscle in your 40s and 50s, we know that's going to impact on your health and longevity by the time you get to your 70s and 80s.
So you might stop taking Ozempic, the weight might come back on, but you don't really get that muscle back, do you?
No, once the muscle's gone, it's really gone. And these drugs, Ali, they're only sort of 6 years, 7 years old. And if we're talking about people being on them for 10 or 20 years, we'd better be very good at monitoring for potential side effects like muscle loss and some other things that may not be so apparent now but do become apparent with years and years of use.
Does that bother you, the idea that we don't know those long-term side effects?
Yes, it does bother me, and it means that doctors like myself, but also patients, if they're on these drugs and they're experiencing something untoward or a new symptom, then that needs to be reported, because otherwise we're not going to find out what those long-term side effects might be. We do know that there's abdominal side effects, gastrointestinal pain, that sort of thing, but there could be unheard of side effects that we just don't know yet.
OK, so it can be beneficial, but be cautious. Thanks, Nick.
That's right. Thanks, Ali.